She put the lime in the coconut, she drank it all up.
Musical automatism. She could be having a partial seizure right now.
Look at her. She needs a full neurological workup. Get house.
If singing like that is a fit, then all clubs need to rebrand to seizure camps. Very excited to be reacting to House MD Season 5 Episode 10, Let Them Eat Cake. On this channel, we are reacting to all 177 House videos, and this will be episode 103. Let's see if I can get the diagnosis before House does as a doctor working in London.
Think healthy and be healthy.
I think it's cramps. Can't go again with him sitting there.
At least let me get a little workout.
All right, take 5, guys.
Those 8 steps are the difference between fat and thin. Nice job!
Are you okay?
"30-year-old fitness trainer suddenly can't breathe, collapses and breaks her ankle."
13 started her clinical trials today.
Normal CT means that her lung problem has the distinction of having nothing to do with her lungs.
Steroids. No one looks this fit without cheating.
Muscles and carbs. My penis is so confused.
Can someone please read her file? Cold air hits the lungs, sets off an attack. Exercise-induced asthma.
Come on, or the shrieking harpy melts my brain.
Exercise-induced asthma actually fits.
I know, you know, she can't know.
The only good way to test for EIA is to recreate the conditions in which the attack occurred.
Anabolic steroids in a boot camp owner? How could he suggest such a thing? They're all natural, right? Men, women, anyone making money from fitness find it hard to resist the allure of a testosterone needle. Usage is also way more common than you might think. Do you know what percentage of regular gym goers use anabolic steroids in the US? 17%. What's even crazier is the number in regular gym going women, 6.5%. Do you know what happens when a female takes testosterone replacement though? It can cause similar effects as in men, like male pattern baldness, excessive hair growth, acne, and weight gain, but it can also do the opposite of magic and make her periods disappear. There have even been cases of women using steroids so much to get in shape for competition, then unfortunately regretting it when losing the ability to get pregnant permanently. But our patient has passed the drug test, so what else could it be? The team is suggesting exercise-induced asthma, but that is about as much of a house diagnosis as the common cold, so something tells me it isn't that. The episode title is Let Them Eat Cake, so could it be related to her diet? Maybe she's having excessive egg whites and given herself a vitamin called biotin deficiency. That's because egg whites contain something called avidin, which binds to biotin that our body needs to metabolize carbohydrates like cake. That's especially true if egg whites are eaten raw, which I wouldn't put past her. There are also a ton of other non-poultry related things it could be, so let's get more clues before we blame the chickens.
It's gonna be okay.
No pulse.
I know the guy running the drug trial, so I get a spot.
You have Huntington's, so you get a spot. Your best tapping rate was 0.004 taps per millisecond. It means your nerves have started degenerating.
We shocked her back to sinus rhythm. Test didn't set it off. For EKG was normal.
Lung problems have nothing to do with her lungs. It's a heart problem that has nothing to do with her heart.
Carcinoid tumor.
Find it, cut it out.
Can a leaking breast implant cause joint pain? I set up an online second opinion clinic because I sort of set it up in House's name.
You cut me in for 30% and I keep your secret safe. Moving into the... Whoa.
That's her stomach? It's the size of a shot glass.
No way geniuses could have spotted this.
This lady's life is about promoting exercise, and it's while she's doing it that her heart stops. The lesson here is we should all just live on McDonald's and buy mobility scooters. Much safer. Okay, don't quote me on that. Our patient may have been honest about not using steroids, but she deceived us in another way. Bariatric surgery. Of course, there's nothing wrong with bariatric surgery, but when somebody mentions that they lost their weight naturally and they had a little help from Senor Scalpel, then the moral compass starts spinning. I absolutely understand that eating better can be a chore though, and that leads me on to today's sponsor, HelloFresh. Mealtimes have always been difficult for me and my wife, and getting our food delivered saves us up to an hour a day on making lists, shopping, and food prep time. What if I told you that you can eat better while saving money and stressing less? HelloFresh lets you do all at once. They've got over 45 recipes, including more than 30 that are calorie smart or protein smart to suit all tastes while being good on the wastes. Join America's #1 meal kit, and this could be your most delicious year yet, with fresh ingredients and professionally crafted recipes delivered to your door. In case that wasn't enough, they've also gone and given me a unique coupon code just for my audience that lets you have 16 free meals and free dessert for life when you subscribe to HelloFresh using my code. That's 1 free dessert item per box while your subscription is active. Once again, click the link in the description or use my code and get 16 free meals and free dessert for life while subscription is active. Now back to our video. The tiny stomach on the scan is probably because of something called a sleeve gastrectomy. That's when someone literally has part of their stomach cut out so they can't hold as much food there, making them full much faster. Losing that much weight quickly with bariatric surgery can have some nasty consequences though. Things people usually see and appreciate are excess skin, low mood and energy levels because of dehydration, and possible loss of muscle as well, but that's unlikely to be felt significantly as the person also gets older. Metabolic effects are really beneficial, like improved diabetes control and lower cholesterol levels, but it can also cause malnutrition. That could be iron, folic acid, vitamin A, B12, or something called protein energy malnutrition, which is the most common. You see, protein-rich foods tend to fill you up more, and having a smaller stomach means many patients become intolerant to them. Other factors contribute too, like poor protein absorption and digestion because of the different way bile and pancreatic enzymes can reach the churned food when it leaves the stomach. 1% of bariatric patients per year are admitted to hospital with this, and when it gets to that point, the outcomes are really poor. Of course, there are risks to staying morbidly obese too, and malnutrition like this can be avoided by following the diet strictly and taking the right supplements. To be fair though, I think that could be what the patient has, so protein energy malnutrition has to be my first diagnostic guess. Question for you smart people, how much weight is usually regained on average at 5 years after a drastic weight loss? Answers down below and I'll give it to you at the end of the video.
Gastric bypass surgery. She had her stomach stapled, then had the records from her files pulled so it wouldn't ruin their DVD set.
Treat her like a fat girl.
Gastric bypass could cause malabsorption by creating a blind loop of bowel. It ulcerates during exercise. Bacteria get loose in the bloodstream, migrate to the heart and lungs.
Thyroid hormones, crash diets, none of it worked. My body was like a prison. When I got healthy, I got happy.
The boob lady emailed me again, complaining of chronic fatigue now. She's going to complain to the licensing board. It's not funny.
It is. You just can't appreciate it because it's going to destroy your career.
Of all the characters in the house, I have to say Kutner is my favorite. How can anyone else top having the world record for crawling the longest distance, defibrillating a wet patient, then setting them on fire, and now setting up an online clinic in House's name? The man attracts more drama than a Kardashian on hormone pills. Interesting though that the patient said she did everything to try to lose weight and it wasn't shifting. We do hear that a lot in the clinics, but is it really possible? I say that because it's getting more and more difficult for patients to say that to justify getting weight loss injections called Ozempic. It's a diabetes treatment that causes massive weight loss, but because of how well it works, it's in very short supply. That's because people who don't have diabetes are getting it privately and using it for weight loss, sometimes with catastrophic consequences. One patient named Michelle Sword is a mother of 2 in the UK who actually bought Ozempic online through an unlicensed provider. She'd used it before and gotten good results, but realized the weight had come back on after, so wanted another pen. When she injected herself with this one, it just kept clicking, which was different to the previous one which stopped after 1 click. It seemed like she didn't get much medicine when she checked the vial, but she started feeling dizzy 15 minutes after and put herself in a hypoglycemic coma. She was taking insulin. Thankfully, she survived, but our obsession with shortcuts to achieve the look we want, rather than trying to construct a healthy lifestyle and habits, is very dangerous. Yes, there are a few conditions which make weight loss very difficult and near impossible, especially for women. They have a naturally lower metabolism anyway, then add in conditions like polycystic ovarian syndrome, low thyroid levels, chronic stress and depression, and things get tougher. That's because the stress hormone cortisol also makes us put on weight. We know that our patient has none of these things though, so what could it be? The team thinks she might have too much bacteria due to small intestinal bacterial overgrowth, but that doesn't cause your heart to stop. It's more likely to lead to things like bloating, abdominal pain, and possibly diarrhea. Since those symptoms match about as much as a chessboard in a German super club, then we need to get creative. Cushing's syndrome could explain a weak heart and even breathing difficulties with a hard time losing weight. It's where you get too much cortisol in your body, and that could be because of a tumor in the adrenal gland or in the brain that are overproducing the hormone. It can cause what we charmingly call a moon face, where the face gets quite round and puffy, and you can sometimes see similar appearances with post-transplant patients who've taken a lot of long-term steroids. I also think the episode title points to something in the diet that's causing this, so I need more clues before using my precious diagnostic guess on that.
That means EEG's flatlining.
You're running on a broken ankle.
And your leg is bleeding. You feel that?
Sending numbness means her nerves are breaking down.
Or her brain.
Or both. Or run an NCB test.
If I'm open about the gastric bypass, no one would listen to me anymore.
Keep your arm raised. Get your muscles.
Excuse me, are you going up to the personnel floors?
I'm going to see Dr. House. We've been emailing. Joint pain and fatigue, thanks to these.
He's actually downstairs.
Gone for the day. We work for him. We can set you up in the ER.
Even fake breasts are more real than the sense of security the internet gives us. I had a half day at work while training and finished my morning shift. In the afternoon, a patient came in and asked in the room I usually work in, is Dr. Sermed here? The next person in the room said no, he's done for the day, and the guy closed the door. This was around November, and the man took out a giant sack and proceeded to raid almost all of the clinical rooms for their hard drives and monitors, leaving only the keyboards behind. He did this all with his face caught on CCTV, so we knew he's not a registered patient, and I'd never seen him before in my life. Why was he looking for me? What could have happened if I was there? Is that how Santa collects his presents before Christmas? So many questions, but he probably found me on the internet and figured out where I work. Putting yourself out there has a lot of benefits, but security is definitely not one of them. It does lower the risk slightly though when you're not impersonating your boss. Now our patient clearly has no shortage of motivation, since she still finds the energy to run on her ankle while it's broken. The fact that she had numbness in her feet now has hand weakness is interesting though. I don't know how Taub has now declared the NCV test useless since her muscles are affected, since numbness in her ankle is still a nerve symptom even if she has a muscle problem in her hand. Who can blame a plastic surgeon for overly focusing on the upper body, although it's usually on a different pair to the arms? So let's assume it is just the muscles. What could it be? Myasthenia gravis could cause muscle weakness, but usually that is after repetitive usage called fatigability, and so we see it more in places like the eyes and the jaw that are working throughout the day. B12 deficiency is still on the cards, and that would explain all of her symptoms as well as match her history of having surgery, but that would affect the nerves, not the muscles directly. Hypokalemic periodic paralysis could cause a similar experience to what the patient felt, like the heart stopping, but then the trace of the heart still being normal if you don't catch it at the perfect time. It could also explain why her symptoms mainly come on when she's doing exercise, as that could be a trigger. You see, in hypokalemic periodic paralysis, you get episodes of muscle weakness triggered by strenuous exercise because of either a mutation in our ion channels that helps salts pass between our blood and our cells, or can come with conditions like high thyroid levels, for example. It would fit pretty well, so hypokalemic periodic paralysis has to be my second diagnostic guess. Let's see how the story unfolds.
Antibiotics make her feel better. She's out of here by morning. She has muscle weakness. Could indicate myasthenia gravis.
It's not myasthenia gravis. Breathing's improving and the weakness is in her extremities.
I don't think sabotaging your boss's office is a wise counterattack.
It can also be any kind of heavy metal toxicity. Lucky for us, we can treat all those toxins with the same thing, chelation.
You followed all of my instructions to the letter. So why are you the only one who can't show up for appointments, Janice?
I'm well aware of what's going to happen to my body over the next 8 to 10 years. I do not need a visual reminder every time I walk into that place.
And you need to get over it. And you show up on time tomorrow, or you don't show up at all.
The chelation didn't work. Her muscles are still deteriorating. Guillain-Barré usually starts as a muscle pain in patients compared to the pain of overexercising.
Her muscle weakness is the precursor to full paralysis.
Go start her on plasmapheresis.
She put the lime in the coconut, she drank it all up.
Musical automatism. She could be having a partial seizure right now.
Look at her. She needs a full neurological workup. Get house.
If singing like that is a fit, then all clubs need to rebrand to seizure camps. Now we have two patients, the email lady who has hair loss, breast implants, tiredness, joint pain, and now a seizure, and our trainer who now hasn't responded to chelation. The patient's now been sent for plasmapheresis because they think she has an autoimmune condition called Guillain-Barré syndrome. You may ask, so what's the difference between chelation and plasmapheresis? Well, I'm glad you asked. Both are supposed to cleanse your blood, but they do it in very different ways. Chelation uses molecules which are like giant sponges that can absorb the offending toxins and pull them out while they're excreted. Agents used for this are things like EDTA and dimercaprol. You can use chelation for heavy metal poisoning, but in plasmapheresis, we hook someone up to a machine, letting the blood holiday, but half of it is stopped to the airport, which are the red cells. The other half, or plasma, gets to go on the trip and comes back clean after entering the Republic of Plasma Filter. That clears out the antibodies before it rejoins the rest of the person's blood to its rightful home in the kingdom of meatbag. This could work, but maybe because it's treating a different disease to Guillain-Barré, which also has antibodies. Let's think about this for a second. Metabolic could be that somebody's spiking her with hormones like cortisol to sabotage her career. Inflammatory could be polymyositis. Degenerative could be multiple systems atrophy. Neoplastic could be a Cushing syndrome because of a paraneoplastic syndrome. Infection could be tuberculosis, to be fair. That does actually work pretty well. Maybe she had her bariatric surgery abroad and that's where she got it. That could also be how she hid the records more easily. And toxins could be organophosphate poisoning from pesticides by eating too many vegetables. That would be ironic, to be fair. I like that option. For our second patient, maybe she needed implants because she had a hormonal abnormality that went undiagnosed and led to small breast development to begin with, like a pituitary gland tumor or polycystic ovarian syndrome. I used my first diagnostic guess on the second patient on female hormone deficiency. This is getting spicy.
I can't tell house.
You'll be in trouble. On the other hand, she's sick.
She's singing.
And bleeding out of her ears and losing her hair.
Biliary tumor causing paraneoplastic syndrome.
I'll scan to confirm.
You want to know what happened to the old toilet? I smashed it with a sledgehammer.
I think in some ancient cultures that was actually considered a proposal of marriage.
Ask her out.
We found out about your gastric bypass. You're not the best. You're a fraud.
Whatever it is, it's now in her brain.
What about a prion disease?
Get a brain biopsy to confirm.
You're not cutting into this woman's brain before you test. You can do a brain biopsy, but only as a last resort.
You're stopping me because you have the hots for me.
One
Why are
that
you dressed like
destroyed-
that?
I think we're supposed to kiss now.
We already did that. It seemed like the logical next step.
I'm an idiot for being surprised.
Your head MRI was clean, means you don't have CNS lymphoma.
We stop at the cafeteria.
I can have something brought up for you. What do you want?
Chocolate cake.
Whatever personal drama you're playing out, you'd be a lot smarter to...
I thought you said she was sick.
Wait. Are you telling me after all of this, chocolate cake could be the treatment? That is interesting because there's something called a ketogenic diet, which has almost no carbs. No chocolate cake can actually help with many neurological conditions. I have a sneaky feeling this is something else though. There is an interesting condition that I know about because we screen for it in newborn babies called MCAD. That stands for medium chain acyl-CoA dehydrogenase deficiency. Try and say that one quickly, but what does it mean? Well, it's a type of condition where people are lacking an enzyme that fully breaks down fat. If they don't eat regularly, then your body starts to try use the fats for energy and can't break it down at enough of a rate to keep up with the body's demands. You can also get harmful byproducts that build up and cause damage on their own. Treatment is basically with regular calorie intake, and that's why cake actually seems to have fixed her. It could explain why she struggled to lose weight before the surgery, as every time she tried not to eat, she felt crappy again. But now she's gone full David Goggins, it's become even more of an issue. It is odd that she managed to lose this much weight without it killing her, but the rest of it fits just so perfectly well. MCAD has to be my third and final diagnostic guess. We are locked in. I know the cake here must be relevant because, I mean, it's in the episode name. For the other patient, a paraneoplastic cancer in the gallbladder is such a wild diagnosis from Kutner, but I bet he'll be right there as well. Let's find out.
You gave her cake. You figured you'd let me play 20 questions instead of just telling me. Brought your cure. Hereditary coproporphyria. Treatment is a high-carb diet rich in sugar. We're self-medicating.
We just have to reverse your gastric bypass.
There's nothing else you can try.
There's not many people that have the guts to admit they'd rather be pretty than healthy.
You're surprised she's superficial? You're a plastic surgeon. This is the human condition. No singing. She's better.
She had a respiratory arrest. We coded her nearly 20 minutes, but she didn't make it.
House is an unemotional child incapable of intimacy or romance. Trust me, it's done. This is my desk from med school.
That woman in the waiting room, she freaked me out about my past.
Your mother.
I wanted her to die. She just yelled so much for no reason. I hated her. And she died.
Did Chase test for the biliary tumor?
Said it was negative.
House is gonna kill us.
Slowly and painfully. What she had was easily treatable. It'd still be possible. Take it down? You kidding? It's way too lucrative to shut it down. I earn 50% for letting you use my name.
You've still got 3 hours left.
Damn, I had the epiphany moment at the perfect time and the right frame of mind, but I went off on the completely wrong direction. My condition had exactly the same justification though. Oh damn. In all fairness, I've never heard of coproporphyria, so no hard feelings. Also, what a brilliant prank on Kutner and Tab. This is why I love House. It has some serious moments, but some incredible fun thrown in there too, with even a bit of relationship drama to ice the chocolate cake. Interesting as well that she chose her looks over her health, but millions of people make that choice daily. I mean, just look up leg lengthening surgery where guys could permanently disable themselves just to gain a few inches in height. Great episode, 8.1 out of 10 entertainment, 7.3 out of 10 accuracy, and 7.8 out of 10 diagnosis. By 5 years after drastic weight loss, more than 80% of the weight was regained. This episode doesn't make full sense until you watch the previous one where a patient takes House hostage because he's sick of waiting.